I was thunderstruck. I read carefully the press release from Moderna yesterday, and they had a sample size, I believe, of 8 people. It really shows that the pros like you are totally fired up on analyzing Delta, Alpha, Beta, whatever the variant is, and the rest of us are out with 15,000 people watching baseball. What are we going to need to do to get America engaged as your profession is engaged right now?
Well, I think we're creeping towards fall, and the hope is that we'll continue to really dig into the data over the next few months to understand how the coverage is going, especially with the Delta variant, which is absolutely gaining strength across the globe. You know, I think these small studies are helpful because it's what we have, right? So it's better than nothing for sure. We definitely want to see more data from the CDC as they continue to look through their breakthroughs. I would love to see a publication from the CDC on what their breakthrough data is showing, perhaps pushing towards some new vaccination strategies to build protection. But these small studies are what we're going to have to keep looking at as we continue to inch towards better coverage with the vaccines and the growth of the Delta. It's sort of a race right now.
If the key factor is the unvaccinated, do you just assume Delta variant could be highly regional or even rural, urban?
Yeah, I think it's that unvaccinated, and I think a lot of us are concerned about what might happen with that single dose vaccinee population. So we did see some good data from Pfizer. We think Moderna is going to be protective. It's the Johnson & Johnson vaccine, people who've had that single dose vaccine. And so perhaps there will be some changing vaccination strategies. We're seeing this in other countries where they might get a booster, like someone who got J&J might get a booster of another vaccine, for example, or also chasing down the people who have only gotten one of their doses and making sure that that second dose regime is being followed. But yeah, those pockets of unvaccinated individuals, we're going to really have to focus efforts on the regional areas where we see low vaccines so that we don't have pockets of large groups of people getting sick and ending up in hospitals and those hospitals being overrun.
Lauren, when do we have to stop worrying about Delta and start worrying about Theta, Eta, Omega?
Yeah, I mean, right now, Delta is definitely the concern. It is inching its way across the globe, and actually not even inching, it's going quickly across the globe. And so I think we will continue to have to keep an eye on it. We will continue to look at new variants as they pop up, making sure that our sequencing capabilities allow us to keep doing that. So continuing to collect specimens, continuing to do the hard surveillance work that our public health entities are doing. But I do think that as vaccine coverage increases, and we have these great vaccines, which is incredible, the new variants become less worrisome. So the more we can uptick that vaccine coverage globally, the less we have to worry about the new variants.
In the U.S., when can kids under the age of 12 start to get vaccinated? Do we have a sense of when that will begin?
Yeah, I think the studies are happening right now. And so I would imagine that we'll start to see that those programs move forward as fall school comes back. I don't know the exact time. I haven't kept up on when they're planning for those studies to finish up, but I do think we will see kids getting vaccinated in the near future.
Lauren, if we look at this July, what we're waiting for is under age 12. When do we see that?
Under age 12 getting vaccinated?
Yeah.
I think that we have to wrap up the studies for the kids under 12 getting vaccinated, and then those programs will start to roll out. I don't know the timing for when young kids will begin to be vaccinated, but I do think that it is on the docket for sure. And it's a priority to get everyone vaccinated, right? And so as we can take advantage of our vaccine supply, making sure that it's not going to waste, that it's either going to people who need vaccine here or going to global efforts to support, worldwide vaccine coverage to reduce the likelihood of seeing new variants. That has to be the priority.
Lauren, I just want to get a final word from you on the data you're focused on right now, a case study maybe in the UK or Israel for that matter. I was going through the UK's recent data, a little more than 20,000 new COVID cases and 23 deaths within the last 28 days of a positive test. Lauren, your take on the data that you're seeing out of the UK, out of Israel and elsewhere?
Yeah, I think we're just starting to see we definitely are seeing that the Delta variant is more transmissible. We're just starting to see the difference in what the symptoms look like, the difference in the severity. I would love to see more data on that. I think it's great that they're releasing these studies quickly, as quickly as they get them, essentially. But it does look like it might be more severe. We just have to wait and see what the data show on that severity, and do all of the hard public health work that has to continue to happen to reduce the likelihood of spread and infection of Delta.